Greetings, I am Tammy Lee Demler. I'm one of your pharmacists here at Buffalo Psychiatric Center. You probably have been in my classroom or have watched some of these shows or programs from the past, and I hope you like them. We take great pride in what we create here. As you know, if you have watched my programs before, you know that I like videos. I've added a few videos to this program today. Hopefully you'll find them interesting. Lots of information about sunscreens. It's the right time of year. Although you can wear sunscreen all year, I do. I have moisturizer that I use on my face that has sunscreen built in. It's an SPF of 15, which is the minimum amount. But I don't have to think about it then. It's already on. You know, it makes my face moist and it's sunscreen. So you may have other similar things that you do to keep your skin safe. I thought it was interesting because in my mailbox today, I ended up with this little Drug Topics 2024 about sunscreen, so I thought we could add some of the details I have learned from what came to me just today to the program that we're going to be talking about. So this is what we're going to be doing today. In a little bit, your pharmacist for the day will be bringing an activity. I'm not sure what they'll choose to do, but it's always pretty cool. So make sure that you give them a shout out and a thank you for participating in your learning today. Please feel free to ask questions. No question is silly or too small to ask. It's important. Sometimes we think that we know something and we learn later that we didn't really understand it. So these are the topics we're going to cover today. Number one, why is sunscreen important? Number two, what type of sunscreen should be used? Number three, what or how do I use sunscreen properly? And then other things I need to know. I like to wrap up with those types of things, and I think that will be where I bring in this magazine article today if we have time, because we've got lots to cover today. And we're going to get started with a video.
We all rely on sunscreens to help prevent sunburn and to reduce the risk of skin cancer and early skin aging caused by the sun. We all can see the differences between parts of our skin that have been sun exposed and those that have not. Sunscreens are regulated by the FDA to make sure they work and are safe. We recently asked sunscreen companies to give us additional safety information about sunscreen ingredients. We're asking because sunscreens are used a lot more now, often daily instead of just at the pool or on vacation. And scientific knowledge and technology have improved our ability to look at safety issues since sunscreens were first marketed. For example, we're closely evaluating the safety of each ingredient. We're also reviewing the sun protection factor, or SPF, to determine if current sunscreen products give enough sun protection. We're also looking at ways to update the labels to help you make good decisions about the sunscreens you use. Asking sunscreen companies for more information does not mean that sunscreens are unsafe. It also does not mean that FDA is taking sunscreens off the market. We requested information because the FDA wants to improve the overall quality, safety, and effectiveness of sunscreens that Americans use. We recognize the benefits of using sunscreens. I use them daily. I urge you and your family to use them. Both the FDA and the CDC recommend using a broad spectrum sunscreen, which means it protects you from UVA and UVB sun rays. It should also have an SPF value of 15 or more if you plan to go outside. But remember to take additional steps to protect your skin. Stay out of the sun at peak times, seek shade, and wear protective clothing, hats, and sunglasses. We're committed to doing our part to help improve the quality, safety, and effectiveness of sunscreens. For more information about sunscreens and sunscreen ingredients, go to www.fda.gov/sunscreen. Thank you.
Perfect. And so keep in mind that, and I'll mention this in a future slide, that because of this information that the FDA is learning about increased use, it's good that we're using more sunscreen, but that should also mean that we don't use old sunscreen. I am guilty as charged for using old sunscreen because maybe I liked a certain product, or I just didn't get a chance to go buy new stuff. But it's important that you make sure your sunscreen's in date and that it is that it's one of the one of the sunscreens that's recommended by the FDA, and you can always ask your pharmacist to take a look at that. Generally, things that are sold, with a brand name product in a sunscreen section, it would be generally considered safe. They're actually using this to be an acronym that they have been added to consider generally recommended as a safe guideline. So ask your pharmacist. If there's ever any question, take a look at that. I'm actually going to take this article home and check my sunscreen to make sure that my sunscreen is in date and has been stored properly. So here's another video we'll go into.
This consumer update is brought to you by the U.S. Food and Drug Administration. Sunscreen can be an important part of protecting our skin from the sun's harmful rays. But how do we know which sunscreens provide the greatest protection? We all need protection from the sun's ultraviolet radiation. Also called UV radiation, it includes both UVB and UVA wavelengths. Sunburn is primarily caused by UVB. Both types of ultraviolet light can cause skin cancer and early skin aging. So how does sunscreen work? Let's think of our sunscreen as if it were a beach umbrella. Does it help protect against both UVA and UVB rays? Or does it let some wavelengths through? No sunscreen completely blocks UV rays, but by using the right product as directed, and in combination with other measures, including wearing protective clothing, you can reduce your risk of skin cancer and early skin aging. To begin providing adequate protection, sunscreens should have a sun protection factor, known as SPF, of at least 15. But that's not enough. This will stop some UVB rays, but may not stop UVA rays. To protect against both, you need something called broad spectrum protection. So let's increase the protection by adding broad spectrum to our SPF 15 sunscreen. Now we're protecting against UVA and UVB rays. Okay, what happens if we increase the SPF to 50, but leave out broad spectrum? The higher SPF provides more protection against UVB rays, but without broad spectrum, this may not adequately protect against UVA rays. So what does all this science boil down to? For greater protection, sunscreen should have an SPF value of 15 or higher and be broad spectrum. Changes take a little time, so you may not see sunscreens labeled this way in 2011. But starting in the summer of 2012, for the greatest protection, look for sunscreens with an SPF of at least 15 and broad spectrum on the label. For more about sunscreen labels and how best to protect yourself, go to fda.gov/sunscreen.
Perfect. And so moving ahead, we have yet another video.
When you're out in the sun and covering up isn't an option, sunscreen can help protect your skin from cancer and early skin aging. FDA-approved sunscreen comes in many forms. Whichever sunscreen you use, make sure it says broad spectrum and SPF 15 or higher on the label. Sunscreen should be carefully applied to all uncovered skin. Reapply about every 2 hours or more often if you're swimming or sweating. The sunscreen label will tell you if it's water resistant, and if so, for how long.
It's good to remember too that clothing also offers an SPF of some degree. Your clothing can have completely blocking effects depending on what kind it is, or offer some shady disbursement of the sun's rays. So clothing does add up to the SPF as well, but it's hard to sometimes know how much. So don't count on clothing entirely. So this is a few things, and it may be hard to see this slide, but I pulled this off the CDC. I thought it was an interesting, an important way of being able to describe this, why sunscreen is important. Skin cancer is the most common cancer in the United States, and too much sun can cause skin cancer. So not only is skin cancer deadly, but it can be disfiguring. So, many times a physician will have to remove part of the skin that is cancerous. Frequently, they'll have to remove a piece of the skin. like a mole or something that looks abnormal. So that's never comfortable, and it's unsightly for some people, especially if it's on your face. I know people who have had skin cancer on their nose, and that's difficult to remove. Unprotected skin can be damaged by the UV rays, as we've talked about, and it happens in as little as 15 minutes, so it's not very long. Damage from exposure to UV rays builds up over a lifetime. So it's not just a really bad sunburn once. It's sort of a sunburn happens when you're 7 years old, then 10 and 12. You know, like the more often you've had sun incidents, it builds up over a period of time. So it's best to try to reduce the number of occasions where you've had too much sun. We've all had a sunburn. It's happened to everybody, but the fewer times you can have that happen, the better, because it's sort of a cumulative effect over a period of time. Don't forget, here in Buffalo, it's not sunny all year round, and we've had many cloudy days, but even on cloudy days, we can see UV rays pop through. I'm surprised. I like to ski, and when it's cold, I never think about really sunburn, but you can get sunburn when you ski. Or when you're outside in the snow, because it's reflective, the sun's rays can be damaging as well. So again, back to making just my lotion hydration for my skin. It has SPF in it, but you know, here at the hospital, you're probably just going to be using regular sunscreen. If it's a sunny day and you're going to go out, ask your nurse for some sunscreen if they don't put it on automatically if you're going out to grounds or such. But you can have sun exposure anywhere. Wearing a hat can be helpful. I like to wear hats because I think they look pretty stylish. But like this lady, her hat, I have one like that. A nice wide brim will help shade your face, your ears. We don't often think about your ears, but those can be very, very vulnerable to sunburn and skin cancer. And when you're going to a skin doctor, they will frequently look at areas like that, which you would never really think about, but your neck, the back of your neck, your ears, your face, and the top of your head. So if you are among the people who might have thinning hair as we get older, some men may be bald, you know, you need to make sure that that skin's protected too, and sunscreen is appropriate for the scalp as well. Wearing sunglasses that block UVA and UVB rays. Now, I will tell you, I was educated on this and I didn't really recognize it, but polarized sunglasses are much better for your eyes than non-polarized. I didn't really think there was much of a difference, but I've been talked into the fact that there is a difference. So unpolarized glasses aren't as protective as polarized glasses are. Again, ask someone if you are in the frame of mind of buying a pair of glasses. Make sure you inquire, ask people who might know. You know, if you're in the market for looking for new glasses, or check to see if your glasses that you're using now are polarized. You might want to swap them out for a pair that are. Wearing clothing that covers your arms and legs. Again, it may be feeling like it's hot outside and that may make you feel warm, but honestly, if you wear a nice cotton shirt, that can really absorb sweat, it can wick it away, make you feel a little bit cooler and be protective against the sun. And the frequency of application, like we saw the video, depends on kind of what you're doing. If you're swimming, it's different. If you're just walking around, it's different. But every 2 hours, it's recommended that you reapply your sunscreen if you're just doing general activities. Again, 15 or higher, broad spectrum. In my article that I promised I'd read to you, they recommended 15 if you're sort of just doing daily activities that are, well, you know, shopping, walking around, you know, running errands, you know, going to work, that sort of thing. But if you're really doing outside recreational activities or work, then higher SPF of 30 or greater is what they recommend. And remember, you know, after swimming, we sort of think about reapplication, but when you're sweating a lot and you're toweling off, you need to also be thinking that that needs to be reapplied as well. Another video.
There are lots of ways to protect your skin from the sun. Hats, umbrellas, umbrella hats, but no matter your style, you should always accessorize with sunscreen too. Always. It's important year-round, and especially during the summer. The days are longer and the sun is stronger. But choosing the right sunscreen can get a little slippery. So, here are some rules to keep in mind when shopping for sunscreen. First, make sure to read the label. There are lots of colorful bottles and beachy smells, but some won't provide the protection you really need. Look for sunscreen with broad spectrum protection. Okay, quick lesson. The sun emits ultraviolet or UV rays, which include UVA rays, which cause skin cells to age and long-term damage, and UVB rays, which affect the DNA in skin cells and cause sunburns. UVA and UVB rays both can cause skin cancer, with UVB as the main culprit. Broad-spectrum sunscreen protects against both. Okay, so that's one thing to check the label for. But also pay attention to SPF, or sun protection factor. As a rule, make sure your sunscreen has an SPF of 30 or higher. This number indicates the level of protection against UVB rays. Sunscreens with an SPF lower than 15 are required to include a warning that they only protect against sunburn, not skin cancer or aging. Oh, and don't forget to check the expiration date. Sunscreen is usually good for 2 to 3 years, but it does become less effective over time. Speaking of becoming less effective, if you're splashing, swimming, or even just sweating, remember that water resistant doesn't mean waterproof. Sunscreen naturally comes off, especially if you're active. Read the label, but a good rule is to reapply sunscreen at least every 2 hours. Rub in at least a palmful of lotion to cover the entire body. Or if using a spray-on sunscreen, make sure to hit all exposed skin areas. Look out for your lips too. Buy some lip balm with SPF. Remember, there is no sunscreen that will protect you completely. Grab some shade and dress smart too. Some clothing items even use fabric with a UV protection factor, or UPF. The higher the UPF number, the higher the protection. But no matter your fashion sense, sunscreen is always the perfect accessory.
I like that video, and I think it's interesting to know that the two different rays have two sort of different actions in the skin, and we want to prevent irradiation from both of those, right? Nobody wants to have wrinkles or have premature aging, but we got to think about that too. So there's a perk to it cosmetically also is being able to have a young, youthful, non-wrinkled appearance. You can kind of tell when people have been in the sun for a long time, they can have more wrinkles, and obviously it's important to know. So another video. I like that, and telling me how much I need to use, because I think I sometimes underuse. I don't realize how much you really need to do, and the teaspoons or tablespoonfuls that they describe help you kind of guide as to how much you need to be using. So here is a quiz, and it's just meant to be fun, but if you are in small groups or if you're at your table, maybe somebody can just shout out what you think the answer is. So how often should you reapply sunscreen when you're outside? You have a choice of at least every hour, at least every 2 hours, every 4. You don't need to reapply or only need to reapply after sweating or swimming. Which of those do you think is right? You answered B, at least every 2 hours. You are correct. Sunscreen should be applied every 2 hours when you are outside, whether you're sweating or not. If you're sweating and you're swimming, it's more often, but at least every 2 hours. So kind of set that clock, in your mind and make sure that you're thinking about that. All right, number 2, a recent FDA study showed that some sunscreen ingredients are absorbed into the body, and this means what? So it means A, I should continue to use sunscreen as directed. Evidence of absorption doesn't mean these ingredients are unsafe. It just means that more data is needed. B, I should stop using sunscreen. C, I should make my own sunscreen. D, I should use only sunscreen conservatively, for example, in limited amounts on sunny days. Which do you think is correct on that one? A, yeah, continue to use sunscreen as directed. The reason that the FDA is doing more research is because we're using more sunscreen. So in a way, that's good. But as you increase your use of sunscreen, exposure to sunscreen, that's how things get tested to make sure that they continue to be safe. So knowledge has evolved. More information about what we need to know is always good. Other methods to protect yourself, though, don't forget it's not just sunscreen. Wear sunglasses, limit the time you spend in the sun. Typically, when the sun's rays are the strongest, between 10 and 2 is what we usually consider the strongest. And to be honest, when you're out at 10 to 2, it's super hot most of the time. So just stay in the shade, wear protective clothing, and then don't forget your sunscreen when you have to go out because you don't want cancer and you don't want to be old, prematurely aging either. Number 3, which of these statements is true regarding sun safety for infants? Now, we didn't talk about that. It's not relevant really to most of us unless you have family members or young children, that you have in your family. We have these questions about that. A, adults are at greater risk than infants of sunscreen side effects such as rash. B, infants can be exposed to the sun for a limited amount of time without risk. Sunscreens are not recommended for infants under 6 months, or protective clothing does not have much effect and sunscreen is a much better choice. So I'll just give you the answer for that one because we didn't talk about it, but sunscreens aren't recommended for infants under 6 months. It's not because they're at less risk, but it's just that their bodies absorb more of the chemicals in the sunscreen, and we also know that they're at higher risk of rash. So we just keep them out of the sun, keep them in their stroller, put their big hat on, and just keep them in for the cooler part of the day, or the hotter part of the day in a cooler area in the home. Number 4, the FDA recommends that you do not use sunscreen products that have passed their expiration date. If there's no expiration date indicated, what should you do? Sometimes it may have rubbed off, or it may not have been a bottle with an expiration date. The choices are do not use it, report it to the FDA, assume it's stable to use because it was purchased within 3 years, assume it's stable to use indefinitely. Oh, I'm thinking you probably got this one right. C, assume it's stable to use if purchased within the last 3 years and has been stored in a cool, dry place. So again, when the FDA was talking about how long it's, they've updated the labeling. So the FDA regulations have require that there's an expiration date unless stability testing conducted shows that the product will remain stable for at least 3 years. So if in doubt, get a new one. But they're saying if you bought it within 3 years, and it's hard to know, right, when you bought it unless you have a receipt. But here they're recommending that you don't have to waste it as long as you know that it's been within 3 years. But discard sunscreens that are expired because we don't know that they're safe and we don't know that they're truly effective. So again, if in doubt, my answer would be just get a new one. You don't have to get a huge size. They have little travel sizes that if you think you want to put it in your purse. I wouldn't store them in the car where excessive extreme heat or cool can happen because when chemicals go out of range, they aren't necessarily stable or effective, and sometimes they can cause more side effects. So number 5, all of these ways to reduce risk of sun damage to your body are true except A, limiting your time in the sun, especially during 10 to 2. B, wearing clothing to cover your exposed skin, like long sleeve shirt, pants, sunglasses, and hats. C, use broad spectrum sunscreens with a sun protective factor value of 15 or higher regularly as directed. Or D, getting a base tan by using tanning beds or laying out in the sun. I think you probably know that one's false. Yes, getting a base tan by using tanning beds or laying out does not change any kind of risk of damage for any skin type, regardless of the color of the skin. And honestly, I can tell you back in the article I read today, what was interesting is that although skin cancer does occur more frequently in individuals with lighter skin, it's darker skin that can have a higher rate of mortality. So your chances of overcoming cancer, if gotten with skin cancer diagnosis, are higher in dark-skinned people. So neither spectrum of light or dark is at lesser risk, really, of outcomes. So make sure you're getting your skin checked. Number 6, true or false? All skin products protect against sunburn, but only those with SPF 15 or higher that are broad spectrum have been shown to reduce the risk of skin cancer and early aging. That is true. And I never gave you the answer to that, so that is true. Number 7, true or false, if you sweat or go swimming, you need to reapply sunscreen more often than every 2 hours if water resistant. That is true. Yep. Number 8, when do the FDA and CDC recommend wearing sunscreen? They have a choice here: while swimming at the beach, while playing outside, on a cloudy day, while skiing in the winter, or all of the above. Yep, all of those above. Absolutely. In general, FDA and CDC recommend that you use those sunscreens even on cloudy days. And then again, at higher altitudes and sunlight can be just as strong as if it were in the summer. Number 9, true or false, getting a tan, whether you're lighter skin or dark skin, is healthy. False. And then 10, a sunscreen label of SPF 15 means, this is good to know, you can stay out in the sun 15 times longer than you normally can without getting burned. B, the sunscreen lets twice as much solar radiation through a sunscreen labeled SPF 30. C, it takes 15 times more solar energy to produce a sunburn compared to unprotected skin. D, the SPF value test tells consumers how much broad spectrum protection the sunscreen provides. Or last, E, you can stay out in the sun for 15 hours without being burned. We know that's not true, so which of those answers is correct? It's C, it takes 15 times more solar energy to produce sunburn compared to unprotected skin. SPF is a measure of how much solar radiation is required to produce a sunburn or protected skin. For example, skin that sunscreen has been applied to, relative to the amount of solar energy required to make a sunburn on unprotected skin. So that's kind of confusing. I would just go with a number and just know that that's important. As SPF value increases, sunburn protection increases. So it's important to remember that there are factors other than the amount of time that you spend in the sun that impacts the level of SPF you need. For example, the intensity of the sun can matter, and where you are, your geographic location can all impact the amount of solar energy you're exposed to. When you reapply sunscreen, you're not resetting the clock. Any sun damage that your skin has undergone remains. So if you got a sunburn and you're reapplying sunscreen, it doesn't take away that sunburn. However, frequent reapplication of sunscreens is associated with a decreased absorption of solar radiation and decreases your risk of sunburn. Yeah, so that's important to know. And then this I'm going to kind of circle back. We have one final video, but sun sensitizing medications. We talk about this with you all the time. When you're on a medication that can make your skin more likely to burn, it can make you more sensitive to the sun. And then, of course, we're going to talk about some of the medications here. I found this in the article I told you about today. Certain antibiotics can cause sun sensitivity. Antifungals are generally used for specific reasons. Many people may have used these for toenail fungus, for example, or nail fungus. If you have a more serious fungal infection, generally you know that you're on an antifungal, but they're not as frequent as antihistamines. Antihistamines are medications that help dry you up when you're feeling allergy or there's that dander in the air. Here are some examples. Benadryl would be one of them, loratadine. Those are commonly used, and you've probably seen them here even in the hospital. Statins for your cholesterol. Diuretics to help keep your blood pressure down, helps get rid of excess fluid. You may recognize some of these. Hydrochlorothiazide is a common one, furosemide or Lasix. Non-steroidal medications for pain, so things like ibuprofen, naproxen. Believe it or not, those are also sun sensitizing. Oral contraceptives for females who are on them, either for pregnancy prevention or for hormonal imbalance. They can be used for a number of different things, but just know that if you're on them, your skin's more sensitive to the sun. Benzodiazepine, antipsychotics, we don't use them as much here as we do the second generation antipsychotics, but we've seen a good fair amount of chlorpromazine and flufenazine. So if you're on those, you're going to want to make sure that you're wearing sunscreen if you go outside. These products for psoriasis are not commonly used, and I haven't seen any of these in the hospital. It's to promote your skin to being sensitive to the light so that if you have psoriasis, you can have certain therapies that make your psoriasis go away or get better temporarily. We have topical retinoids like Retin-A, so for acne, we'll see. We have a few people on that in the hospital, but generally there's a sticker that says sun sensitizing. Make sure that you're protected. It's a version of vitamin A that's topical to help with acne. And then so we have some sulfa antibiotics, sulfa drugs that are also sun sensitizing. And then last but not least, some medications for diabetes like glipizide or glyburide. They are still used for type 2 diabetes, not somebody who is just on insulin alone. So hopefully, if you're on one of those, you've already been notified that your skin can be more sensitive. But if not, I'm hoping that this video helps to remind you of that. So photoallergy is a little different. This can still be a reaction, but this is a chemical structural change of the drug in the skin, and you get a rash, and it can spread to different parts of the body. So it would be your physician that would be determining whether you have a photoallergy or phototoxicity. But just again, know that sun and drugs and skin don't mix often very well. And then we're going to talk about some things with a little video at the end here, which I think you'll like. And if we have time, we'll wrap with another few little conversation pieces.
Mankind's age-old treasure hunt. The search for health and vitality in the beneficent rays of the sun. Millions of people make regular pilgrimages to bathing beaches and other places especially favored by the sun, seeking its health-giving bounty.
How does sunlight, or lack of it, affect your health? Vitamin D, also known as the sunshine vitamin, comes from exposure to sunlight. When the sun's UVB rays hit the skin, a reaction takes place that enables skin cells to create vitamin D.
Vitamin D is related to many different things in health, not only bone health, but also musculoskeletal, also the ability to fight infections, to cancers, and a whole bunch of other medical conditions.
So being starved of sunlight can be detrimental to the human body.
Well, somebody who has very low vitamin D levels, who is not on vitamin D supplements, can have problems with bone formation. So it's how the bone forms with calcium and vitamin D, and that can lead to a condition called osteomalacia. It can also lead to increased fractures.
The Institute of Medicine recommends that the average adult get 600 to 800 units of vitamin D a day. And while severe vitamin D deficiency isn't common for most adults, supplements can help when needed.
There's vitamin D2 and there's vitamin D3, and both are effective at restoring the body's stores of vitamin D.
But too much vitamin D can hurt too.
And people who are on mega doses of supplements, for example, 100,000 units a day, can get vitamin D toxic. And the only way to know that is they'll get high calcium levels. So they'll get symptoms associated with high calciums, which could be things like confusion, abdominal pain, kidney stones, things like that.
And a number of studies are underway to investigate all of the health benefits associated with vitamin D.
Vitamin D is basically linked to hundreds of different medical conditions. We are seeing some more studies that are going to be supplementing people with vitamin D to see if it actually improves some of these conditions, but the jury's still out.
Perfect. And so I wanted to make sure at the end of our conversation together that you didn't think that sunlight was a total villain. We have sun exposure having potential advantages. So you'd want to have some occasion where you may have a sunscreen free period of time, no more than 15 minutes, but just, enough to just get a little bit go in there, because it's helps support bone health. It lowers blood pressure for some people. It can prevent some diseases, as the doctor mentioned on our video, and it promotes good mental health. You feel good when you're in the sun, but that can also be with sunscreen and being in the sun. But just having that vitamin D, being able to boost your energy and your spirits. And remember, too much of a good thing can end up with bad stuff too. So cancer, premature aging, development with cataracts, and other harmful effects. So keep that in mind. And with that, we are, I think, done with our program today. Your pharmacist, if not already there with you now, will be coming soon and doing something really cool and fun. So we'll see you next time. Have a great day. Take care. Stay safe in the sun. Goodbye.